Is there a shortage of physicians in the United States? The answer is yes, but it depends on what you're talking about. So, for example, there might not really be that bad of a shortage of high paying specialties, but there is a severe shortage of primary care doctors. So, why is that, and how does student loans potentially influence this? That's part of the question, but the reality is the majority of physician shortage issues that exist in America are really due to shortages in residency slots for the most part and restrictions on the ability for various healthcare practitioners to practice. So let's give you an example. In 1997, Congress passed a limit capping the amount of residency slots funded by the government at 100,000 total. Now, before that, when Medicare got passed during the Johnson administration, the government got into funding residency slots for the first time under the Medicare program. Before that, why were residencies called residencies in the first place? So the reason is actually because residents actually lived at the hospital, hence the name resident, right? So you had places like Johns Hopkins and the most prestigious teaching hospitals in the country developed training programs where these physicians in training would basically live in the hospitals, make very low pay, and they were willing to do that because of the prestige of the institutions. Gradually, since the most prestigious hospitals had this way of doing things, that got adopted more broadly across the entire country. And then to make sure that there was enough physicians to treat all of these elderly patients that the government was now paying for, that's one of the reasons why the government got into funding residencies in the first place. Of course, whenever you have huge government involvement in something, it's susceptible to things like lobbying and budget restrictions and various competing priorities over federal dollars. And before 1997, we had a huge influx of immigrant physicians from a lot of different countries to alleviate some of this shortage. And even today, you will see a lot of first-generation immigrant physicians in America in a lot of these places that are more rural areas or underserved areas to fulfill specific needs that were set and as a condition for easing up immigration restrictions back in the day. Now, immigration is a lot tighter now, and it's a lot more difficult, I believe, to become a physician as an immigrant than it perhaps was in the past. So we have a situation now where we have this physician shortage, and we are not allowing immigrant physicians in the country, probably because you're concerned if you're an existing physician making a good living that you don't want to have a lot of physicians come in, say from Korea or Poland or something like that, and drive down the wages that you're able to receive. Now, on the flip side, also with the limit in residency slots, that prevents you from having too many physicians or enough physicians really to fill all the gaps that exist. So just to think about this, in other areas of the professional world, we're seeing a huge problem with an oversupply of spots. So for example, pharmacists, there are way too many pharmacists right now relative to the demand, I think. And you're seeing this in the form of a lot of reduced hours available, a lot of layoffs, people having a hard time getting full time in a lot of different parts of the country, and wages are not necessarily growing like you might think they would be. And you're seeing this also in the legal market. You had to have a lot of law schools closed because people weren't getting enough legal jobs, that required a JD. And you can go on and look and see that a lot of these different fields that don't have high barriers to entry to enter the field except for the credential, you're seeing an overproduction of people in those fields, and you're seeing a limit on the growth in wages because of that oversupply. So it's kind of like economics 101. And why is this happening? Well, it's just because you don't have that cap on the number of people that are allowed to go into these training programs that then allow you to earn the big salaries. You just go straight in for most of these professions, right? And so because of that, there's no cap except for accreditation bodies, which are generally controlled by the colleges and universities that exist, or at least the associations a lot of times are heavily influenced by colleges and universities, right? And so you have situations where the number of pharmacy schools has quadrupled, or doubled, over the past short amount of time, really. So if you think about the problem with medical schools have not been able to expand that much by comparison. Medical schools might have increased maybe 30% or so in the number of students that they have enrolled since the early 2000s. Compare that to the number of pharmacists, that's increased maybe by 300% or something. It's just absurd. And that's because you don't have this barrier to entry of a residency where you have to do one of those. And now obviously, there are some training programs that exist. Pharmacists do have residencies, lawyers do have some training programs that exist, but you don't have these required programs where you must do a residency in order to practice. Now, with this shortage that exists, what kind of incentives are created by virtue of these capped residency slots? So think about the 100,000 cap. Now, there are some extra spots available that are funded by, for-profit hospitals or for states or something like that. But in general, that's a fairly, solid cap that's existed for, the past, 20-ish years, okay? So that means that if you have a certain number of residency slots you're allocated, of course, some of those are going to go to primary care and internal medicine, family medicine, things like that. But really, the hospitals are highly incentivized to establish residency programs for higher paying specialties because they're going to make a much higher profit off of you that way. So the residency pay scale is really not all that different depending on what your specialty is, right? So you might be making a very similar salary as a resident, if you're a neurosurgery resident or if you are a primary care, internal medicine resident. So that same salary scale, again, incentivizes them to go after residents that bring in, a lot of revenue by virtue of their specialty. So you've got a big incentive to produce a lot of people that are coming out with, procedural-based surgical skills, and a lower incentive with these capped residency slots to come out with people in these primary care kind of specialties. Also, physicians actually face a huge incentive to specialize right now. We have done a lot of work at Student Loan Planner analyzing the cost of loan forgiveness for different specialties within medicine and to figure out which specialties pay the least. You might be surprised to realize that when you're in training, you can pay $300 a month on your student loans and get credit towards the nonprofit loan forgiveness program, PSLF. So neurosurgeons, because they train for 8 years in some cases, 7 or 8 years, you might pay $300 a month for 7 or 8 years, or maybe even longer than that. And then you might only pay as an attending for maybe a couple years. And then at the end of the 10th year, you get your loans forgiven tax-free. In contrast, a primary care physician might pay for a resident income for 3 years and then become an attending and have to pay significantly more over the life of their loan because they have to pay income-driven payments, so they lose 10% of a higher income sooner. And so if you look at the cost, in many cases, we've modeled loan forgiveness costing primary care physicians triple the cost of what it would cost much, much higher earning specialists. So that's just an indication that our student loan system and the way we fund residencies in America is basically designed in such a way that it creates a natural shortage of primary care doctors. So the only way around that would likely be to create more ability for nurse practitioners and others to access the ability to see patients without a doctor's supervision. And that creates a whole another plethora of issues. A lot of questions are raised by that, but we have to realize that if there is a physician shortage, it's because of our own making. It's not because of some strange outside force that exists. So that's just something to think about, something to chew on. I will say this, that medical school is, in comparison to other professional programs right now, because of the weird student loan rules that exist, it is actually a much better program compared to go into in terms of course of study financially than a lot of other fields out there. Not necessarily to say that you should do it, but it's certainly interesting to look at the incentive models and to understand why there's a shortage, especially acute in primary care, whereas there's not that big of a shortage in a lot of these higher paying specialties, especially in the big metro areas, which are really desirable to live in. So if you have a lot of questions about your medical school loans, about how to optimize things, just reach out to us and check out our site, studentloanplanner.com/help.